in its pain. The abscessed tooth causes children and middle-aged people to lay awake at night, not sleeping. We take this for granted with our Western dentists because even those who are underserved can usually get in for emergency treatment. So much of the world can't get in for emergency treatment. But if we even study that segment of our fellow Americans who can't afford to go to the dentist on a regular basis, it's embarrassing. Approximately 1/3 of our fellow Americans only see the dentist on an emergency. I think it's paramount that we find quality alternative materials to the expensive indirect, that we realize that with high-strength adhesives and quality filled resins, we can restore even cusps when necessary, preserving dentition and with an emphasis on aesthetics, meaning that we can even have one clear message out of our mouth for rich, for poor, of aesthetics, reaching more through technology, through creativity, through science. For sure, moderate long-term, we've got to find a cure to caries. In the interim and with our downturn economy, we must be more serious on using now technologies of high-strength adhesives and quality filled resins to serve more of our fellow Americans to meet their needs. We get asked quite often by humanitarian dentists what we can do to help them. We have a policy that we've had for years that we will donate whatever products that humanitarian dentists need going on their missions. So certainly, any dentists who do such work, which is so gratifying in so many ways, we are honored to help you with whatever of our materials we have to help you in that endeavor. We have supported locally a program for children who are in lower socioeconomic groups. Sealants for Smiles, it's called. We supply all the sealant material, no charge. We're happy to do that should you have similar programs or want to start similar programs in your communities. We must think about those less fortunate than us. Governments, as a rule, have not been real effective in this regard. As humanitarian dentists and as companies who care for humanitarian efforts, we can make a difference. Relative to what young dentists can expect from Ultradent. If you're a young dentist now, in the future you may see us bring some cures for caries. We'd be excited to be able to do that, and we invest and work in that direction. I'm a firm believer, however, if we could bring a cure to caries today, we'd still need more dentists. Why? People are living longer, keeping their teeth longer. Teeth are like tires. They're good for so many miles. The treads wear out, the flexing, the bending, the sidewalls give out. Certainly humans of today are demanding pleasing smiles, aesthetic dentistry, and the like. Our greatest challenge is going to be able to have enough dentists to serve the masses of boomers in nursing homes and even for those who are active with the challenging dry mouth syndrome and the rest and the fallout to the dentition that comes with that. That's going to be a real challenge. I'm only concerned how we're going to be able to address that if we don't find some significant ways to significantly reduce the magnitude of caries that we see today. Certainly for my colleagues in Puerto Rico, for my fellow Americans there, I'm sure you live what we live here in the Rocky Mountains. You see the downturn economy, you see the need to find alternative modalities to help those you serve. There's opportunities here. There's certainly opportunities through technology. I encourage you to embrace the high-strength adhesives. Do not succumb to the weak, quick, rapidly applied adhesives simply in the name of speed. There's true opportunity to not compromise on your adhesives, to develop and hone your skills, to create directly in the mouth gorgeous aesthetic restorations. And down in Puerto Rico, you have some of the finest Michelangelo dentists in existence. a number of quality clinicians giving courses, leading by example with the quality aesthetic dentistry they do. So keep up your good stuff down there in Puerto Rico. In a few more months, I'm going to be very envious I'm not with you. We'll have sub-freezing temperatures and snow. You'll be basking in the sun, enjoying your fabulous Caribbean paradise. I can't wait to get down there that time of the year. Thank you kindly.